Well, hi, we are thrilled to be having Dr. Ryan DeLapp provide a five-part series on strategies for promoting culturally responsive care when working with people with diverse racial and cultural backgrounds. So, Dr. DeLapp, can you first maybe just give us a little insight into what this series is all about?
Yes, this is a series that really I'm very excited to offer because it helps us as clinicians to pause and really be thoughtful about the ways in which our clients' backgrounds, racial and ethnic backgrounds can feel important and relevant to the work that we do. And it helps clinicians to be thoughtful about this and to also be sensitive in how they bring these topics up. And then last but not least, it helps us to be thoughtful about the types of interventions that we're offering and considering how sometimes we may need to be a little bit more considerate of how maybe challenging these interventions may be to implement when and don't doing so in spaces where people can be judged or treated differently because of their background. And so you'll get a chance to hear about all of these types of considerations and hopefully walk away feeling empowered to um, strengthen this role within your practice.
Amazing. Why is this an important series for people to attend?
I think this is an important series because I think us as clinicians have a unique role in being able to treat the whole person. And I know that sometimes clinicians maybe feel a little bit anxious or uncomfortable or unsure how to bring these topics up and how to be respectful of the whole person, including someone's racial and ethnic background. And I hope that when people come and do this series and participate and learn about the different resources in this series, that they walk away feeling a greater sense of confidence that they can hold space for this in a way that's sensitive, respectful, and also effective with the patients that they're working with.
I love it. And one of the things we see a lot is people kind of talking about what they can get out of trainings. What are the kind of like big takeaways, the action items? And what would you say that people could expect to walk away with from your trainings?
Yeah, so a couple of things. One is how are you assessing or making space for the types of stressful experiences that people encounter because of this part of their identity? You'll get tools and exercises and discussion prompts for being able to sensitively incorporate that in your work. But also at the same time, how do we create space and celebrate the strengths that someone brings from their cultural backgrounds into therapy and make sure that we're incorporating those in a way that helps the patient feel seen, but also helps them to feel like these tools are applicable to more areas of their life. And then last but not least, you'll get tools for efficiently conceptualizing how racism related stress can be relevant to your patient's life, whether that is a child as young as, elementary school age, all the way up to adults who have maybe had to navigate different types of spaces with these types of this type of stress. How can you think about incorporating that into your work and in an efficient way and kind of see how evidence-based interventions could be more respectful of those types of stresses?
Something we all need for sure. We also we have five parts to this series, and each training is a standalone. But what would you say to people about why it might be helpful to take all five in this series?
Yeah, when I was thinking about putting the series together, I was thinking about a story that, I want to walk each clinician through. And that first part of that story is really pausing and understanding your internal story, your identity journey, your ways in which these parts of yourself, like your race and your ethnicity, show up in the room, and how that may influence how you feel when engaging in this type of discussion. And then next, we're going to talk a little bit about assessment and, as I was mentioning before, creating space for the strengths and the stresses that people may encounter. And then next, we're going to dig into evidence-based interventions that we are gold standard methods for talking about and supporting people's emotion regulation, their problem solving, and kind of ways in which they pursue control and agency in their environments. And then also the ways in which they think about being their selves and confidently expressing who they are, and thinking about what evidence-based interventions do we have in our toolkit to be able to kind of broach these subjects with our patients in ways that are culturally sensitive, supportive, and responsive. And so we're going to kind of cover a lot in this five-part series, and it's all going to build upon each other. And again, my hope is that you walk away feeling empowered as a clinician to do this work in a way that's maybe different and enhanced than what you maybe are already doing.
I'm excited to take this one. One last question for you, Dr. DeLapp. There are so many trainings out there with a focus on DEI and improving cultural competency. What would you say differentiates this series from maybe some other trainings out there on these similar topics?
The emphasis of this training series is going to be flexibility. And that is, how can a clinician flexibly adapt their treatment plans to be responsive to the specific needs and interests that a client has in terms of talking about their racial and ethnic background in therapy. I think other approaches maybe are, recommend maybe a more comprehensive way of doing things, such as, here's 10 sessions or 12 sessions for how to talk about race and therapy. And sometimes that's not going to be of interest to individuals that we're working with. Also, sometimes we see trainings that are very focused on principles and just guiding guidelines and general recommendations for how to go about doing this work that sometimes are hard to translate in very concrete ways in the room. So also this training is going to give very concrete, very applicable tools that clinicians can take straight from the webinar into their next session and hopefully feel like they're able to do that in a way that feels very effective for them and the work that they're doing with their clients.
Amazing. Well, thank you so much, Dr. DeLapp, for taking the time to help us learn a little bit about your training. Very excited for this to start in September.
Sounds good. Thank you so much. And I hope to see you all there.